Scene script. Hello there, I'm Dr. Johnson, a cardiologist, and today we have Charlotte, a medical student, and Noah, our patient. It's a pleasure to meet you both. Now, Noah, you mentioned that you've been experiencing some breathlessness recently, correct? In medical terms, we call this dyspnea. It's a condition that can be quite disconcerting, and it's often a signal that something might be going astray in your body. Dyspnea can be caused by a multitude of conditions, and it's our job to figure out what's causing it. Many people immediately think of heart or lung disease, and indeed, these are often the culprits. However, it's important to remember that dyspnea can be the result of a wide variety of disorders, not just cardiovascular or respiratory issues. Speaking of cardiovascular causes, these can include acute myocardial infarction, congestive heart failure, and various forms of heart valve disease, such as aortic or mitral stenosis or regurgitation. Arrhythmias, cardiac tamponade, and even something as rare as a left atrial myxoma could be the cause. On the respiratory side, conditions like asthma, chronic obstructive pulmonary disease, and upper airway obstructions can lead to breathlessness. Parenchymal lung diseases like acute respiratory distress syndrome and pneumonia, as well as pulmonary vascular conditions like pulmonary embolism or hypertension, are also potential causes. Now, these are just some of the potential causes of dyspnea. There are still numerous other possibilities, including neuromuscular disorders, chest wall disorders, and even conditions related to anxiety or hematological and metabolic factors. But Noah, don't let this long list of potential causes worry you. Dyspnea is a common symptom, and most causes can be managed effectively once we've identified them. It's important to remember that every patient is unique, and the cause of your dyspnea could be different from the next person's. That's why it's so essential to have a thorough investigation. Noah will need to investigate further to pinpoint the cause of your dyspnea. Let's delve into the cardiovascular causes of dyspnea, Noah. First and foremost, we have acute myocardial infarction, or in layman's terms, a heart attack. This happens when the blood flow to a part of the heart is blocked, often by a blood clot. This can cause shortness of breath or dyspnea. Then we have congestive heart failure and left ventricular failure. Essentially, the heart is not able to pump as well as it should, causing blood and other fluids to back up into the lungs, resulting in dyspnea. We also have heart valve problems like aortic and mitral stenosis. These are conditions where the heart's aortic or mitral valve narrows. This narrowing prevents the valve from opening fully, which reduces or blocks blood flow from your heart into the main artery to your body and onward to the rest of your body, causing dyspnea. Aortic and mitral regurgitation are also culprits. This is when the heart's aortic or mitral valve doesn't close tightly, allowing some of the blood that was pumped out of the heart to leak back into it. This leakage can also result in dyspnea. Arrhythmia, an irregular heartbeat, can cause feelings of breathlessness. Cardiac tamponade, which is pressure on the heart that occurs when blood or fluid builds up in the space between the heart muscle and the outer covering sac of the heart, is another cause. Constrictive pericarditis is a condition where the pericardium, the sac-like covering of the heart, becomes thickened and constricted, limiting the heart's ability to function properly. This too can cause dyspnea. Lastly, we have left-sided obstructive lesions, such as left atrial myxoma, a rare non-cancerous tumor in the heart. These can obstruct blood flow and result in dyspnea. Elevated pulmonary venous pressure, a condition where the pressure in the blood vessels that lead from the lungs to the heart is too high, can also lead to dyspnea. Cardiovascular causes are just one part of the puzzle, Noah. Respiratory disorders can also lead to dyspnea, Noah. Imagine the respiratory system as a busy highway. Now, if we have airway diseases such as asthma or chronic obstructive pulmonary disease, COPD exacerbation, it's like having a traffic jam. The air struggles to move freely, leading to shortness of breath. Also, an upper airway obstruction, maybe due to anaphylaxis, a foreign body, or even mucus plugging, can cause similar issues. It's like a roadblock on our highway. But what about the houses off this highway? The lungs, they can have problems too. We refer to these as parenchymal lung diseases. Acute respiratory distress syndrome, or RDIS, pneumonia, and interstitial lung disease fall under this category. It's as if the houses themselves are on fire, causing chaos and leading to difficulty in breathing. Now let's consider the vascular system of the lungs. Picture it as the fuel supply to our highway and houses. Pulmonary vascular diseases like pulmonary embolism, pulmonary hypertension, and pulmonary vasculitis interfere with this fuel supply. It's similar to having a fuel shortage or blockage in supply, causing our system to falter. Lastly, we have the pleural diseases, such as pneumothorax and pleural effusion. The pleura is like the protective fence around our property. If it's damaged, it can cause problems. For instance, pneumothorax is when air leaks into the space between the lungs and chest wall, like a break in the fence. On the other hand, pleural effusion is when fluid accumulates in the same area, similar to a flood. Both conditions can cause shortness of breath. So you see, Noah, each part of our respiratory system plays a crucial role in maintaining normal breathing. A problem in any part can lead to dyspnea. It's like a well-oiled machine. Every cog needs to function smoothly for the entire system to work. Respiratory causes are another significant part of the puzzle, Noah. There are other possible causes of dyspnea, Noah. Let's delve into the realm of neuromuscular and chest wall disorders. Conditions such as C-spine injury, polymyositis, myasthenia gravis, and Guillain-Barré syndrome can also cause dyspnea. These disorders disrupt the normal functioning of muscles and nerves that aid in breathing, leading to shortness of breath. For instance, Guillain-Barré syndrome is a condition where your body's immune system attacks your nerves, causing muscle weakness and potentially leading to dyspnea. Next on our list are anxiety and psychosomatic disorders. Believe it or not, your mental state can have physical manifestations. When you're anxious, your body goes into a fight or flight mode, which can result in rapid breathing or dyspnea. This isn't to say that all cases of dyspnea are psychological, but it's worth considering if other causes have been ruled out. Lastly, let's look at hematological and metabolic causes. Anemia, acidosis, and hypercapnia fall under this category. To give you a bit more context, anemia is a condition where your body lacks enough red blood cells to carry adequate oxygen to your tissues, which can cause dyspnea. Acidosis refers to high levels of acid in your body fluids, often resulting from kidney disease or severe dehydration. Hypercapnia, on the other hand, is a condition where there's too much carbon dioxide in your blood, which can also lead to dyspnea. It's crucial to remember that dyspnea is a symptom, not a disease in itself. It's like a smoke alarm. It tells you there's a problem, but it doesn't tell you what's burning. The underlying cause could be anything from a heart condition to lung disease, from neuromuscular disorders to psychological factors, or even hematological and metabolic issues. Understanding the cause is the first step to treating dyspnea, Noah. Noah, your case is unique, just like everyone else's. Dr. Johnson begins, his tone reflecting the gravity and importance of his next words. Understanding the causes of dyspnea is a significant first step, but it's just that, a first step. It's one thing to have a grasp of the potential causes, be it cardiovascular, respiratory, neuromuscular, or even psychological. However, it's an entirely different ballgame to precisely pinpoint the exact cause in an individual's case. And this is where the importance of professional consultation comes into play. He pauses, allowing his words to sink in before continuing. You see, each person is a unique puzzle. The way a disease presents itself in one person can be significantly different from how it appears in another. This diversity is due to a myriad of factors: genetics, lifestyle, environment, and even other underlying health conditions. Dr. Johnson leans back, his hands clasped together. A healthcare provider's role is to piece together this puzzle. They use their years of study, experience, and a holistic understanding of the human body to determine the exact cause of your symptoms. Only then can an appropriate and effective treatment plan be put into action. He shifts forward, his demeanor serious yet reassuring. Remember, the information we've discussed is intended to inform, not to diagnose. While it's beneficial to have a working knowledge of your symptoms, it's essential not to jump to conclusions. Self-diagnosis can lead to unnecessary anxiety, incorrect treatment, and even exacerbation of your condition. Dr. Johnson's voice softens, his final words echoing in the room. Medicine isn't a one-size-fits-all field. Each patient is a unique case, each symptom a piece of a larger puzzle. It's the healthcare provider's role to put these pieces together, he concludes, his words imbued with a sense of urgency and sincerity. Remember, Noah, self-diagnosis can be dangerous. Always consult with a healthcare provider for a proper diagnosis and treatment plan.